This is Krystinne, and today we're going to be doing the assessment of the abdomen. This is my patient, so obviously we're going to first check the patient name band, explain what we're doing that day, and we're going to wash our hands and begin the assessment. The first thing we're going to do is ideally the patient would be without a shirt, obviously, and we would drape them for their privacy. We're first going to look at the contour of the abdomen. We need to stoop down on the right side and look over the abdomen, and we see that the contour for this patient is rounded and no distension is noted. The symmetry for the patient's abdomen is symmetric and no bulging or masses are noted. The umbilicus is midline and no redness or discoloration is noted. It's also inverted and no hernia is noted. The skin on the patient's abdomen is clear and even in color. And the skin turgor we can inspect by pinching a mass of skin, and it returns immediately to its former place. Then we're going to look for pulsation or movement in the abdomen. We see that there's good even respiration movement. And if we look over the upper epigastric area, we can see the aorta pulsation may be visible, which is a normal finding. And we're also going to observe that there's no peristalsis movement present. The patient's demeanor, the face is calm and comfortable with a relaxed expression, and respirations are even and slow. Then we're going to auscultate for bowel sounds now. So we're going to start in the right lower quadrant, and we're going to work our way in a clockwise motion. We just listen for a few seconds in each quadrant, and I can note that there's normal bowel sounds heard in each quadrant. Then we're going to also auscultate for vascular sounds. We can try to listen for the aorta here, then the left renal arteries, the right renal arteries, then the left iliac artery, right iliac artery, and the left and right femoral arteries. And there should be no vascular sounds noted upon auscultation. Okay, so next we're going to percuss. We're also going to start in all four quadrants in the right lower quadrant. So we're just going to percuss in a few spaces in each quadrant. We're going to move up to the right upper quadrant, then to the left upper quadrant, then to the left lower quadrant. What we're looking for is more tympany than dullness when we percuss. Then we're going to percuss the liver space and the spleen. For the liver, we're going to start at the mid-clavicular line and percuss until you feel dullness, and we'll mark the space. Then we start in the abdominal area, and we percuss upward until we feel dullness again. We mark, and we can note there, if we measure, that it's about 10 centimeters, which is a normal finding for a healthy adult. Then when we percuss the spleen, we're going to start by the 9th or 11th intercostal space in the left mid-axillary line. So we're going to reach over to the patient until we feel dullness again, and we mark the space. Then we start in the anterior axillary line, and we percuss again until we feel dullness, and we will measure that area, and we can measure that it is about 6 to 7 centimeters, which is normal. Then we're going to palpate all four quadrants. We start with light palpation, again in the right lower quadrant. Again clockwise to the right upper quadrant, to the left upper quadrant, and the left lower quadrant. So there's no rigidity noted in the abdomen, no masses or tenderness, and the patient was not guarded during the palpation. Next, we can go to deep palpation. You can use one hand or you can use two hands. This top hand by pushing down, and the bottom hand relaxed to feel anything. Okay, again, no masses noted, no tenderness upon palpation. and the patient was not guarded during this. So next, we're going to palpate for the liver, spleen, and kidneys. To palpate the liver, we're going to start We're going to place the left hand under the person's back for support of the abdominal cavity. And then you're going to put your fingers parallel to the midline and press down. Have the patient breathe slowly. And with every exhale, you should be able to feel something firm if you do palpate the liver. It is also normal not to feel the liver, so we note that there's no enlargement there. Then we're going to try to palpate for the spleen. We're going to start with our right hand, again, under the side of the patient to support the abdomen. And we're going to put our left hand with the fingers pressed towards the axillary line. We're going to have the patient breathe deep while we press down. Okay, and the spleen is not palpable, which is a normal finding. Then we're going to palpate for the kidneys. For the right kidney, you can place one hand under the abdomen and one hand on top and squeeze together. And there is nothing palpable, so that is a normal finding. And same for the left side. We're going to place a hand under and palpate down. And nothing is palpable, so that is also normal. So there is no enlargement of the kidneys and spleen noted, no tenderness upon palpation, and the liver, we did palpate something small but firm. And that is the end of the assessment. Thank you.